Okay.
Stephanie, would you please do the roll call?
Well, I'll be Stephanie today.
Okay, Lynn, would you please do the roll call?
Okay, and it's gonna take me a while to get the hang of this. All right, Deb Rouge.
Here.
Georgiana Schuster. Oh,
Here.
yay.
Sorry.
Yeah, you can keep yourself unmuted if you want to.
Okay.
Vicky Nicewander
Here.
and Ann Robin.
Here.
All right.
All
Well
right.
done, Lynn.
I did
Zoom
it.
instructions. I guess everybody's got the Zoom instructions because we're all here. Can I have a motion to approve the agenda?
I'll move.
I'll second. This is Deb.
Any questions or comments about the agenda before we do roll call?
No.
All right, Lynn, will you be Stephanie?
I'll be Stephanie. Georgiana Schuster.
Yes.
Vicky Nicewander.
Yes.
Deb Rouge.
Yes.
Ann Robin.
Yes.
All right.
Okay, is there any citizen input or public participation at this time? Okay, as always, if someone comes forward later, we will make time for them in our agenda. And that takes me to my chairperson's comments. This is a relatively decision-free meeting. So there is a lot of information in the board packet, and I went over it. Some other people went over it. I had a very fruitful discussion with Lynn yesterday. So when we get to the discussion part about later items, we can have some more discussion, but we don't have a lot of decisions to make. So thank you for being here. And Lynn, do you have any comments?
You're right. This is a pretty short board packet. Well, short in the sense that you don't have a lot of action items, but I also thought that we've already started getting some input on the priorities documents. So it's possible that at your November meeting, we could bring you a final draft of both the 3-year plans, revised objectives for next year, and then a priorities document, which is the main thing in here for discussion. That would set you up in really good position to either not have a December meeting or have a December meeting that doesn't have a lot of action. So if people are unable to attend, it's okay. So there are some things that we want to do in December, and we have after this meeting, there's an RFP pre-proposal conference, which no one has indicated that they're coming to it. So it'll just be me keeping the Zoom open for a while to see if anyone comes or comes through the door. This is just part of the process of doing an RFP. There's another RFP requirement, which is attached to your December meeting. So I need to do it, but that doesn't mean you all need a December meeting. So something to think about. And I did get really good feedback so far on the priorities documents. So anyway, that's really all I've got. I don't want to dominate because you do have lots of comments today.
Okay, thank you. Thank you, Lynn. Next item is approval of the board meeting minutes. And I did ask Lynn to add something to the minutes. Lynn, do you want to just explain that briefly?
Yeah, actually, this is the board packet. I'll show you this. The board packet has 2 sets of minutes for you to approve. The first one is your regular meeting from September 21st. And then the second is that joint meeting on the 28th. And what Dr. Robin has asked for is a little bit more detail about here, where Mr. Hausman had some edits and we did them during the meeting. And so it's on the recording, but what would be helpful is to add, I'll show you, I gotta pull the other document down. I started a draft just in case, and I will share the screen with that. Just to add a link here, if that's okay. There's the revised final draft of the RFP is not in your board packet, but it's posted on the bid page. So we would just add that link right here to the final draft, which has been published. It's published in a few places, but it's on the county bid page. So anyway, so I would,
Okay. Lynn,
like-
I don't see the link on the screen.
I didn't drop it in yet because.
Okay, all right.
Yeah, but it would be like, I mean, I can go find it. It's just this stuff takes a while.
Okay, sure,
to-
sure. Yeah,
So,
okay.
so to put the link there and to add something like, the final draft is available, or the final version is here. In fact, I could
Okay.
do that like this. The final version is here. And I can go get the link because I put it in an email. Sorry. So anyway, if,
Okay, that's
Uh,
fine. You can put that in there. That was the only thing that I asked for. I guess I should ask for a motion to approve the minutes from 9:21 and 9:28
well,
before we have this
could you-
discussion.
could you hang on a second? Because
Yeah.
if for me to do this, I have to close that screen and put a different one in.
Okay,
Okay. Sorry. Oh, no. It shared the. I don't know how to undo this part. All right.
okay, you
I'll
can,
figure it out. It's
you
just,
can append that.
yeah, I mean, I'm not normally updating minutes anyway. I'm
No,
trying-
no,
Yeah,
yeah.
Stephanie's not here today. So anyway, if others have, I want to share the actual minutes so that you can all have a discussion of the whole thing. Okay.
Okay, is there a motion to approve the minutes?
I will make the
No.
motion. Georgiana.
Great.
And this is for
I'll second.
9:21 and 9:28.
Yes,
Okay.
both sets of minutes.
All right, we already started discussion based on what I talked with Lynn about yesterday. That was my only request, that we have clarification of what those edits were. And she's going to make that happen online. Any other discussion?
I think that was a good, suggestion for a change, and I don't have anything else.
We're asking Lynn to do too many things at one time.
It's, I think it's mostly because the computer's too small. So like,
Yeah,
if I could see it all, this is not
Okay.
hard stuff.
Well, Lynn, it would be perfectly acceptable to me, and I hope the rest of the board, if you add that after we have this discussion. Shall we go to roll call? You're doing it.
Oh, yeah, you're right. I'm getting ready. I'm trying to set up the next screen so that I don't slow the meeting down. And I'm slowing
We're
it-
asking Lynn to multitask way too much here.
Yeah, I think
So-
Stephanie may be getting a raise after today's meeting.
You know
We all
what?
do appreciate Stephanie. I'm gonna put that in the,
You
the
are
minutes.
not kidding. It is
we appreciate Stephanie.
that you are right. Okay.
Who's
I'm ready.
taking the minutes today?
I'm doing it.
Oh,
So,
my God.
Good.
well, actually, it's
That's
different
way too
because it's all recorded. So she
Oh,
okay.
listens to the whole record. So it's okay. So Vicky Nicewander
Yes,
and, oh, no, Deb Roosh,
Yeah.
Georgiana Schuster,
Yes,
and Ann Robin.
Yes.
All right.
All right, we accomplished that. Yay. Okay. Now the next is the vendor invoice list on page 13. Can I have a motion to approve?
I'll move to approve.
and I will second. This is Georgiana.
Okay, now open for comments about the vendor invoice list. Comments or questions? Okay, I don't hear any right now. I do like this new format, I must say. And can we have a roll call, Lynn?
Deb Roosh,
Yes.
Georgiana Schuster,
Yes,
Vicky Nicewander,
Yes,
and Ann Robin.
Yes, All right.
Yeah.
Now, if I am not mistaken, that completes the action item part of this meeting, and we can go on to have discussion. So item 10 is the draft PY 24 allocation priorities and selection criteria, pages 14 to 26. And then if we don't prolong that too much, then we get to go to our favorite part of the meeting, which is successes and other agency information. But let's have a little discussion. And I did have a couple of comments, but I will let other people make their comments first. Anybody want to say anything about these priorities?
Whoops. Sorry, I'm trying to share the screen again. Oh my goodness.
Okay, well, I will make my comments and maybe that will stimulate a little more discussion. On page 15 in the board packet, there is some information about the PUNS summary of county and selection detail. I'm not arguing with this. I just wanted to point out that these numbers are things that we've gotten used to, so we're no longer shocked by them. But I personally am going to continue to be shocked by them. The fact that there are 70 people waiting for out-of-home residential services with less than 24-hour supports and 44 seeking 24-hour residential in our county, to me is shocking, will remain shocking. And I just want to put that on the public record. My understanding is that the biggest obstacle to providing services for these people still remains the Medicaid waiver reimbursement rates being so poor, which takes me to my next comment on page 17, non-compliance with Ligas consent decree, inadequate Medicaid waiver reimbursement rates being a big part of that. And there is a question as to whether unused ARPA funds could still be liberated to help with this situation. So those are two comments that I have to make, and I'll leave it open to other people if they want to say anything.
And this is Deb. I just want to say I completely agree with you back in the fall. And the only reason I didn't bring it up before is that I've gotten so used to it. Some days I just feel like we're going nowhere, and I find it difficult to stay positive that anything substantive is going to happen to.
So is there anything that we can do to advocate for use of the ARPA funds for? Lynn, do you have some comments?
Well, this has been, we see that Kansas did it. They used ARPA funds to create incentives for direct support professionals, a couple different kinds of incentives, including for part-time people. And then Virginia was about to do it, like the House introduced one way to do it using ARPA funds. The Senate introduced a different way to do it using different funding. That failed. So we could be a little jealous that it got that far, because in Illinois, it wasn't even in the original ARPA plan in spite of input from the public saying it should be. And they did do bonuses for people providing elder care. So, I mean, it just seems like a really obvious, they have leftover money. It seems like an obvious advocacy point. So it's starting to come up in different state associations. I think Ed McManus wrote about it a couple months ago. So I think that what we can do is through our state association, continue to advocate for that, like press on the state to use their leftover ARPA funding for this, because Illinois was behind before the pandemic, and now everybody's behind. And if other states if Kansas can do it, we can do it. So that's,
Is there any way for citizens to have input, not through the state association? I mean, that is being done, but is there anything extra that could be done by citizens,
you know, I haven't seen,
such as
any-
ourselves?
yeah, I mean, I haven't seen an opportunity for public input from the state. That's pretty hard to do. They usually don't give you the link till it's, 2 days. Have we lost internet? Have
I
we lo-
got you.
Okay. It just looks like I lost connection for a second. I haven't seen a link to do any public input, but I don't know, do other folks know? I mean, because it's been coming up, people are talking about it, so maybe there is a link for the public to communicate with the state. about this.
Oh, I would think there's always the option of contacting your legislators
That's what I was gonna
and getting
suggest.
them on board.
Yeah,
Mhm. Okay. That's a good one.
And more people need to do that, I think.
Yeah. Well, I think we have pretty good representation here, especially for developmental disabilities issues.
Well, is there enough interest from this group that we could either individually, or I don't know if it would make any more sense to do it as a board or just individually and identify ourselves as advocates for developmentally disabled, that we could individually contact our state legislators.
Mhm.
I think as a board, we would have a little bit more impact. Would you
I don't
like?
know. I have no
Well,
idea.
And I mean, I can do that on the board's behalf. But I think numbers matter too,
Numbers matter.
not just organizations. So I think there's value in both, and I can certainly do that on the board's behalf. But I think hearing from people, I mean, if the state has leftover ARPA funds, this is a great time to communicate that. And I think they do.
Okay, well, I don't want to take this whole meeting to make this happen. And I also need to be mindful of the Open Meetings Act if we're going to communicate with each other. I could draft something. I think anybody else could probably also draft something, and I would identify myself as a member and current president of the Developmental Disabilities Board and a mother of a developmentally disabled person. Each of you could identify yourself as a member of the board, and whatever else your concern is. Would it be okay, Lynn, if we share, some sentences with each other about what we want to say? I mean, I don't have it in my head right now. It would take me probably half an hour to compose something.
I think it's okay if you want to do it through me or through Kim Bowdry, then that protects you if you're communicating with each other one at a time or through us, and we can
Okay,
protect the
open meetings. We're not
meetings.
having a group.
Yeah.
Okay, well, I would suggest that over the next week that we don't put it off, that we do that pretty soon. And we can send individually to our state representatives.
Okay. I like that idea.
I mean, it's something, Deb.
Yeah.
Right, something.
It may not be
pardon me,
everything,
being-
but it's something.
Yeah.
We're also
Sure.
we're working on like some of the maybe underlying, like some foundational stuff at the national level, like just the idea of the Bureau of Labor Statistics creating an individual classification for direct support professionals. That doesn't seem like it's going to solve anything very fast, but there really does seem to be poor understanding or no understanding of what is expected of this workforce and what's special about them. So the idea is like, if that can be built and described separate from home health aid and other similar, but maybe less demanding or less complicated work. That then it would be easier to persuade legislators to appropriate enough money to create a true community-based system, which relies on direct support care. So anyway, we can keep working on those things. It's, Kim Bowdry and I have a lot of these conversations, like even in those circles, people don't really know enough and don't seem to have the amount of respect for this work that we do. So we keep pushing it. Anyway.
Hey, I have an idea. Somebody could do a Netflix special featuring a direct service provider, and they could get a popular actor or actress to play that role.
There you go. That's great.
That would build public sympathy.
Yeah.
I heard Netflix was coming back up again. This is why I said Netflix.
Okay.
Okay, so I had another comment going back just a little bit on page 16. Actually starts on page 15, annual report prepared by ISC staff. And there's a lot of points in there, but what I took from it was sort of toward the end that individuals living with developmental disabilities, people living with developmental disabilities are interested, like everybody else, in meaningful work, meaningful volunteering, and fun and meaningful clubs and organizations. Many of those opportunities look like they are available to those individuals, but they are not necessarily taking advantage of those. There's a barrier between the person and the opportunity. So I just wanted to have a little discussion about, okay, what are those barriers? People say they want to go to sporting events, swimming, concerts, theater, music, arts, museums, working, bowling, archery, all these different things. What is preventing people from participating in activities that would be meaningful and enriching for them? And identifying the barriers, what can we as an advocate group do to help overcome those barriers? So that's the discussion.
We have a comment in the chat.
Okay.
From Danielle Matthews, who's the director of DSC, that advocating for more than the proposed $1 a year increase would also be great. Amen. Yeah, we'll be there for that. That these $1 increases, like while they're stunning amounts of money, when it comes down to a person, it's not going to attract enough people back to the field and keep them. So that's a good advocacy point too. When we have opportunities, whether it's to write to legislators or file witness slips, which is really effective, and it's not that hard to do once you've set up in that website, or to advocate, with legislators for that. I think that's important. So thank you, Anne. Thank you for pointing this out. I'm glad that you noticed this too. I felt like, and I believe Kim also did, that felt really struck by, like, all of this is stuff that we have agencies who really know how to do. We know agencies who know how to do this stuff, and some of it
are doing it.
Yeah, and there are also people who might not even need agency support to get what they want. They just need transportation options.
Right, and they might need a support person to assist them who's not available. To me, those are the two biggest there in a nutshell. Is who's available to support that person in these activities, and how do they get there?
And then to really appreciate, like, how important these things actually are to person's well-being. This isn't just, a list of fun things to do. It's like, turns out to be one of the keys to wellness. So
Well, I just want to say, the last thing I want to do is to give any impression that I am criticizing the really excellent work that our local agencies are doing in these areas. Because I do appreciate that. And I know that the last 3 years have been challenging to the max, and people are getting back up again. I'm just pointing this out as basically, I would actually like to hear from the agencies either during this discussion or later as to what their ideas are as to how we might be able to help work with them to mobilize community resources. And volunteers is the thing that comes to mind. People could be buddies. We have organized volunteers to do transportation for the refugees that are coming into our community. We could certainly work on volunteers to provide transportation for developmentally disabled. And I don't know what all the complications are with that. There's insurance, there's liability issues. So I would be very interested to hear from our agencies that are doing this work on the ground, what some of their ideas are.
Would it be possible for us as a board to develop a request of agencies that, this is something that we would like to have developed? They seem to be the ones that have the knowledge about the processes and people and the issues involved. And if we say, we would like to find a way for individuals to be able to access the recreational opportunities that they like to access without necessarily having to be included in a large group event, getting on the bus and going to a festival with 20 other people, that we would like it to be more individualized. And how can that happen, if even on a small basis to start with? I know it typically what we've done in the past, at least my understanding is that you get a proposal, this is what we want to do, but you're not really asking for anything specific other than what your priorities are. Am I making myself at all clear? I'm seeing confused looks.
I'm a little unclear as to what you said, Vicki.
Okay, so my daughter is a perfectly good example. She lives in Muhammad. She does not have access to transportation under her own power. She has a personal support worker who will do that for her. Most people who have personal support workers, they work from 9 to 3 or whatever those are, that the hours that they determine. But if you have home-based, then that person could take you places outside of those daytime hours, to choir, to a ball game, to any number of different things. I think most opportunities for that type of event happen in relatively, it's in groups. So a group home may all go out to do an activity. They don't have the staffing necessarily to provide supports for individuals to do that. And so I'd like an agency or other agencies to think about how they might provide some of that additional support in maybe a more creative way, but we'd have to allow for that to happen, not on our criteria, but allow them to develop something that might work.
So
Yeah, I think that's clear. Thank you.
Okay.
in the application itself, there are a whole bunch of open-ended questions in which an agency could focus that way if we're clear that we want that. So I think that's a really important suggestion. It's just, I'm not sure that we're not saying exactly what they should tell us in those open-ended questions.
Yes.
So
Can you solve this problem?
right, that's more what we're looking for.
Yeah.
Well, I'm just looking for suggestions.
Yeah.
And I realize that there are definitely complications, especially when you're using private cars to transport people. There's issues of liability and insurance that I don't know how the refugee volunteers are getting around that. I think people are just doing it. And maybe agencies would have concern about that. One idea that comes to me is that we've got the Special Initiatives Fund for short-term projects that's going to be available in the coming fiscal year and is open for applications. This might be an area that somebody would come up with a creative solution for, or creative idea how to address this problem.
And I wanted to throw out another possibility, the retired senior volunteer program. I don't know how occupied they are, but it seems like that would be a good source of volunteers for an agency or for us to just, provide transportation to people who want to go places. It's another possibility.
I think that would be very hard for us to coordinate. But I think that maybe an agency could take that on.
Yeah. Yeah.
Well, I'm just putting it out there for people to start thinking creatively, and definitely not to put more burden on our agencies that are working really hard already, but they're the ones that have the expertise as to how things are working right now. So we don't want to reinvent the wheel or do something on top of something that's already being done. Any other comments on this topic?
So I told you that I've already gotten some really good feedback on this document. You ready to see it?
Yes.
I mean, we're like, Kim already sent this out to the agencies and stakeholders for any feedback from them. So what we've got so far, this is I better share the screen. Okay. And I actually have a new draft. So just looking through stuff, like I know that our stuff always could be clearer. And so when I get any kind of input about this could be clearer, thank you. So just here the sentence structure was it said including those available to people who do not have IDD. So just to make it very clear what we're talking about, I changed it to including those benefits and resources which are available to people who do not have IDD. That's directly connected to this major finding that we've just been discussing about the local preferences. So I think that is a really important clarification. Then there's a similar statement a little bit later in this priority. It's more clear, but I went ahead and added, it said opportunities available to community members who do not necessarily have IDD, I said, which are more readily available, just to be very clear to the point. Like there's not as much specificity in this set of priorities as there has been in previous years, but, kind of pointing toward like what you're all talking about, like solutions for this kind of like greater engagement in everyday life, which keeps people well and safe and happy. And our agencies know how to do this stuff. They just are struggling to stay fully staffed and maybe struggling with some paperwork requirements. So we're going to work on that too. And then anyway, so those were 2 items. I love that kind of feedback. And then later there was another way down toward the end under process considerations. There's some traditional language that it used to just say further to be eligible to receive CCDDB funds, applications must reflect the board's stated goals, objectives, operating principles, and public policy positions, period. And an applicant would not necessarily know how to find all that stuff unless they were coming to all of your meetings, which that's great. If people come to these meetings and tell us their perspective and hear your perspective, that's wonderful. But there might be applicants who can't do that. So I had added this downloadable versions of these board documents are available on the public page of the online application system at But then, and I thought, and Kim and Leon and I put all these downloadable documents there for people to have access to, whether they're a funded agency or not, just publicly available everything. Like reports from previous years, every board document that you approved, it's all there. Well, it turns out to be a very long list. So this is not easy to do. So when we were talking about it, I thought, well, maybe that first sentence was too heavy-handed anyway. So I don't know if you all feel that way, but it's traditional. And I was thinking that we sort of cover that already. And you're also asking for innovation and for creative ideas that you may not have stated publicly. So maybe that language is just outdated. So this is what I'm proposing to change along those lines. Just make it simpler, point people to the downloadable documents. I've just purchased an archive so that the downloadable documents, which are not related to this year, can be archived, and people will only have to look at 3 or 4. So it's a more doable task from the technical perspective, but in this document, just shifting the focus a little bit. Do you all mind that?
Nope. That's good.
Well, Lynn, you and I discussed this yesterday, and I am in 100% agreement. I read that sentence and it just kind of flew by me, but it's boilerplate. And it does sound kind of heavy-handed and paternalistic, and I think it's time to get rid of it.
It just feels like
And
it.
I had comments on that too. I followed it along, to the letter and went to that website and looked through the documents, and there's no documents that are specifically named those things. And so I had trouble going from this sentence to those documents. So I think doing something to make that easier for the uninitiated to follow along. What are the agency's policies and ideals and so forth? It needs to be simpler. That's my opinion.
I love
Georgiana, are you happy with this new language that Lynn put in? Does that help you, especially if the link is really operative?
Tell me, I'm looking at it right now online, and it says, an applicant may learn more about the board's stated goals, objectives, operating principles, and public policy positions from downloadable documents on the public page of the online application and reporting system. I think so. I think that's a little bit clearer than before. It said something about downloadable versions of these board documents are available. And there were no board documents that were named stated goals, objectives, and operating, so that it made it hard to go from this sentence to those downloadable versions. So yes, I think this is easier to follow. I'm always reading our documents as the uninitiated, because I feel pretty much like I am the uninitiated, and so I'd like to have other people who are reading it for the first time read it with some ease rather than a question mark, I guess.
Thank you for that. Are there any other comments about this particular point? Well, I think that covers everything that I had written down as my questions. What other questions do other board members have or comments?
Well,
All right.
I
Yeah.
just one
Go
quick
ahead.
thing. I hope it's a quick thing. Just a question about the process of gathering the data of the was it a survey that gathered this data? Or was it from person-centered plans?
No, it's two different survey processes. So, I mean, I get, maybe which one are you interested in?
Well, I was just interested in the one on page 15 and 16, all the data points regarding, these percentages of people who wanted to do certain things, where that came from. Was that just a typical survey answering questions, or was that from collating person-centered plans that had been done for people?
That would be so cool if we did that. That's,
We don't do that yet.
I love that. And maybe we could figure out a way to do that, or an agency would do that for us, but no, it's different. Hey, Kim Bowdry, are you in a good position to explain it? I'm really sick of hearing myself talk. And you're the expert on this one anyway.
Sure. So part of our contract with the Regional Planning Commission ISC program, it's actually Decision Support Person Centered Planning, also the ISC team, they're one and the same. Part of our contract is that when they are doing the annual PUNS update or new registration of PUNS, they also offer for people to do a preference assessment. And in this document is most of these questions that you're referring to about the leisure activities and what people want to do. And so people have the opportunity to say, no, I'm tired of doing that survey for you. So over the years, I think that started when I worked at Regional Planning Commission in the Independent Service Coordination Department. So maybe like 2015. So it's been several years. So some people are tired of it. Angela Yost worked with the U of I evaluation capacity building team this past year, and they modified that and kind of turned it into a little bit of a satisfaction survey. So there has been some changes, and that's why you might see some newer information about how long people have been on the PUNS waiting list, or how long they've been on a waiting list for services through an agency. So there was some changes. So we have a kind of a split year of the data for those two surveys. So I think that's where Lynn referenced the two surveys.
All right, thanks.
No, I was talking about, you did a brief survey in the.
Oh, my survey. Okay.
Yeah.
Well, Suzanne's survey.
Thank you, Kim. So I love the idea though of like collecting information from people's person-centered plans. That's cool.
It would
Well,
be
that would
less
that would be-
surveying.
That would be a good question, if that could be done, protecting people's confidentiality and with their permission or whatever.
It's just, we're learning that like sometimes the simplest and most obvious things take a really long time to complete. That's just, it's getting data from 400 person-centered plans. Kim and Leon just finished assembling the performance outcome reports from all the agencies, and just putting all those things together into one document is very difficult.
Oh, sure. And you don't want to do it, after you've done the 400 plans. You want to start with plan 1. And say, okay, here are the 3 points we want to add to our data collection for,
I think this is also something like it's an aspiration with the CQL personal outcomes, outcome measures that, there's a process there, but it is also quite time consuming. But like, anyway, that's gold, that kind of information, like what people say they want to work on. I love it. Anyway, all right.
So Lynn, I just want to ask you, we're ready to move on to successes and other agency information, which is our favorite part of the meeting. And then we do have some more business to discuss. It is 9:45. Are you obligated to be available on this other link at 10 o'clock that nobody has signed up for?
People can join this meeting and wait for this meeting to be done, and the pre-proposal conference will start immediately after.
Okay, all right, so we're good.
We're good.
Okay, all right. Well, are we ready to move on to successes and other agency information? Board members, do you agree? Okay, who wants to go first? Lynn, can you see who's got their hand raised?
No, I see Becca Obuchowski raising her physical hand. And,
Okay,
and
physical
Annette
hand
Becker
counts.
is also appears ready to talk, so.
All right.
I'm happy to go first. I can never find the actual on Zoom raise hand thing quick enough, I feel like. So I'm with Community Choices. And I wanted to speak to just a couple things. I think the conversation that you all are having, particularly around accessing community resources and events and social sort of leisure venues and things like that is a really interesting question, and something that we talk about and think about a lot. We obviously do some of that, both in terms of some groups as well as kind of individual connections to things in the community. And while I think we do reach a pretty good portion of people, we also know that there's a lot of people who want those things that we're not reaching. And so one thing that we've been talking about for the last couple of weeks is how do we get more information from those people that we're maybe not reaching as easily, to figure out what the barriers are to sort of helping get them connected. And so we're hoping to get that started. We're going to do just basically a series of interviews with people over the next sort of month or two. To get a sense of what might be a barrier. I think transportation, which is of course always a topic of conversation, I'm anticipating that is a big barrier for people. And I've also talked with other people from other organizations in the last few weeks, like including the YMCA, saying that, transportation is of course for them, and people using their services a really big issue too. So anyway, not exactly good news, but definitely we are kind of, I think, of similar minds of like, these are things that are really important, and how do we kind of make sure people can access them and know that they're things that we can support with. In terms of other things, just in transportation, for example, we've actually been partnering with the MTD for the last 6 or 7 months. They've been giving us basically a free dash cards that we can sort of use to help people learn how to use the bus. And so we've been doing that where we have opportunities for people to take the bus with us to our social opportunities. I think there's a lot of folks who are not super comfortable riding the bus on their own, or just haven't had a chance to practice some of those skills. So trying to sort of integrate that as a reliable option for transportation. Obviously, it doesn't work for everything, and so we've been able to support about 11 people with that in the last few months. So not a huge number, but we've been excited to work with them too. So yeah, stop chattering.
Good morning. I agree, transportation is a huge issue, and I want to echo Becca's comments. MTD is a great partner. They provide us with dash passes for people too, and the majority of our groups, we do use the MTD when available, but getting out to the Y and different places like that is pretty challenging, so it's a blend. On a totally different note, we've been able to start 2 supported employment sites. We're working on a 3rd, and those tend to be for people who really need the support of a DSC staff person in order to maintain their job. They tend to be a few times a week, maybe 2 hours per day, and we're supporting 10 people through those opportunities. So we're really excited about that. Thank you.
Thank you.
Danielle, can you explain what you mean by supported employment sites? What are they? What do you do there?
Okay, so we have, we're working with the Champaign Park District on one of them, and we go in and kind of provide extra support for their maintenance crew who can't take care of some of the areas of the building that get high usage. So we're doing things like we're wiping down the equipment that's used in the sporting area, the sporting areas. We're also doing some light cleaning. We're replenishing supplies. And we actually are doing that at 3 separate buildings. So we go from building to building. And that's a crew of 3 people. And then we're also working with AMT, and now it's escaping me what that stands for, but it's a medical transportation. So it's ambulance services. And we are taking care of some office work for them. And we've recently added, they have a house for people who are on call 24/7. And they use that every other week, and we're going in and helping kind of clean that up in between uses. And then the next one we're looking at is at Blue Stem School. And we also will be helping take care of their building while the students are there, and then shortly after they leave. And that one's going to be 1 day a week. The other 2 are 3 days per week for about 2 to 3 hours a day.
So your supported employment means a DSC person is with
Correct.
the workers.
Correct. You know, we help people, we set up checklists. Sometimes people have a hard time going from task to task. We also have a young man who's participating, and he really wants to work, but his life is pretty chaotic. So sometimes him just being ready when it's time for him to be picked up is very challenging. And so we're starting with those basic things too. So in a situation that maybe he's not ready one day, you know, it's cool. We have a substitute, and we're helping him think about things like get your clothes ready the night before, you know, make sure your clothes aren't in the washer when it's time to be picked up. So some very basic things, you know, making sure you have your lunch, set your alarm clock, doing those basic things so that you can actually get to your job.
Okay.
Sounds like the kind of thing a lot of young people could use.
Yeah, I think it is a very common, and even for me, sometimes I still have to remind myself of those processes.
All right, thank you very much for that. Those are very interesting. There is a virtual hand up. Who is that?
Mel is ready.
All right.
I don't know if I'm ready, but good morning, everybody. But I think I might have just a little of a good news. So I am a board member for Illinois Respite Coalition, and we had just had our meeting last Saturday, and it really relates to what we're having a conversation today. I'm pretty happy to share with everybody. So I don't know if you guys are familiar with Illinois Respite Coalition, but we do try to help anyone that is not receiving any funding from the state of Illinois. And so we have that in-home program that anyone could call the Illinois Respite to see if they qualify. And then also this year we have had an additional funding there's also this voucher program that we're pretty excited about, because beside the in-home respite that we offer, this might be an opportunity for someone, like, you remember respite is to provide a break for the main caregiver. They might be able to provide a voucher, like a little bit of financial assistance for someone to access an activity that they wanted to provide that as a thing to provide respite to the main caregiver. For example, if they want to access a camp or something, you know, and it costs this much money and stuff like that, rather than doing an in-home respite, they can choose that one. So it's an or kind of activity. You can do an in-home or this voucher program. And then on top of that, we have 3 programs. So on top of that, we have an emergency respite. Emergency respite is for anyone that's not receiving any funding, of course, from the state of Illinois, but still needing that respite for any age, any disability, and it doesn't have an income limitation. So they don't, it's the income level that's not affected. So we have those 3 programs that you could possibly call Illinois Respite to see if you qualify. Again, I just attended our board meeting last Saturday. So I'm asking all this information. I'm hoping, crossing my finger, that I will get all my flyers from IRC for the expo to anyone to stop by our booth. I can share that and everything. So I'm hoping that would help anyone in the central southern Illinois area. And we're really hoping to reach out to this area to be able to share that funding.
Thank you. Anyone else? Well, I think that segues very nicely into something that I wanted to add to the agenda, and I didn't add it. It's basically, I guess it's under board announcements, so I'm going to just do that right now at this time. The Disability Expo is this Saturday, and we didn't have that on our agenda to announce that. And Lynn said it's because she thought everybody already knew about it, but I thought we should just make that announcement one more time in this public meeting.
I see some hands up.
May I just add to that very briefly?
Yes.
So I'm coordinating the volunteers for the expo, and we still do need people to sign up. So if anybody here at this meeting, or anybody, if you're connected to any groups who might be interested in volunteering, we definitely still need help, particularly later in the day. There is some teardown tasks, but they are like very light teardown. It's not really anything too heavy. I would be happy to put the link to the sign up in the chat if anybody would like to share that or to sign up.
Good job, Becca.
Thank you.
There it is. Thank you, Becca.
Okay, I don't know how to take this information and save it on my computer. So that's,
Oh, the link.
The link information.
yeah.
Maybe make a screenshot. Can you do a screenshot?
I don't know how to do a screenshot. Everybody talks about screenshots. I looked it up and I still don't know how to do.
You know what I can do?
Everybody else knows.
Forward. I can forward the email that Becca and Chandra, y'all sent out an email yesterday, I think, with that link. So I can forward that to you.
Would you do that?
Yep.
I don't have any young people in my home to teach me how to do all this stuff. You're lucky I can do a Zoom meeting. Thank you for that. All right, any other comments about Disability Expo or any other agency information? Then we'll go on to old business, which is the fiscal year 22 utilization summaries for funded programs, pages 27 to 30. And I did have a couple of comments and one question about that. The first comment is on page 27, CU Autism Network, which I believe is a small agency run by citizens. We give them only $38,000 a year. And I don't know if there's anybody from that agency on this meeting. It's a network, really not an agency. But I just wanted to note that at the bottom, they've exceeded their goals for community service events by almost 50%. So kudos to CU Autism Network. And I have been around Carle Clinic and Hospital a lot this last summer. And I have seen the evidence of CU Autism Network very visible, just, walking by desks. And it's very good. And I participated in one of their workshops. So good job, CU Autism Network. Public statement. Then I have a question, and my question is really to both DSC and I'm just blanking on your name, Community
Choices.
Community Choices. Becca, why couldn't I think of choices? Okay. You have, there it is. You have a different way of measuring what we're calling CSE. CSE stands for, what is, I don't even remember what it stands for. It's a
Community service event.
Yeah.
Well,
It's screening and service contacts that you were asking.
oh, it not wasn't CSE, it was
Yeah.
SC. I
Yeah.
wrote it down wrong. SC, screening or service contact. SC. It looks to me like Community Choices and DSC are measuring two different things and calling them both SC, because Community Choices is measuring theirs in the thousands and DSC is measuring theirs in the tens.
And this is how they define it in their applications. And so I don't remember exactly the difference, but I was speculating yesterday. So.
Okay, so would somebody from Community Choices like to say, for example, a priority work life? I mean, kudos to you for doing this great work, but what does 1,795 SCs measure?
Yeah, absolutely. And for our programs, for the most part, they're the same across programs. So this would apply to our employment, it would apply to our inclusive community support programs. But the service contacts, the SCs, what we're counting there is the number of claims that we have uploaded into the online system. And so we would do a claim anytime we're providing support to a person. So if we're meeting with them to work on job development or job coaching, if we're going to a person's house and helping them build a skill, if we're, and they can also be, the way those claims are organized, it's there's sort of two categories. There's like with the person served and on behalf of the person. And so those service contacts could be something that's on behalf of the person. So if we are putting together, materials for an application for an apartment for somebody, where they're maybe not actually with us at that moment, we would also count that as a service contact. And so those numbers should match the number of those individual claims that we've uploaded into the online system. Then I think it's other, listed as other, that's the number of hours. So the number of hours of direct service that we've provided to the same people that the service contacts are listed for. And so the number of service contacts is like the number of instances of support, whereas the other category is the duration of time in hours. And then the like TPCs is that's the unduplicated total number of participants that we've served in that whole program.
Okay, that is very, very useful and helpful information that I did not get from this document. So thank you very much.
Certainly.
Okay. Who would like to speak for DSC as to how you're doing these measurements?
This is Annette. Vicky's really kind of our expert in this area, but our service contacts are contacts we have with people who aren't receiving services yet, but are interested in hearing more about the service that we provide.
Okay, so you're measuring something completely different. And that's what I thought from looking at these numbers, because you're both providing a lot of services to individuals in the community. But I would suggest that in the future, we clarify what these categories are, because when I'm looking at it and I see SC, I think it's the same thing, but it's not the same thing at all.
So you want us to copy from the applications into this summary report? The definition?
Well, I just need a clarification as to what this means. What are they actually measuring? Becca did a very good job of explaining what they're actually measuring. So we could have just a little section at the beginning that said, this is what this means. Because when I see SC means service contact or screening contact, I don't know, is that number of individuals? It looks like what DSC is measuring is number of individuals. And what Community Choices is measuring is every time they have a contact or
Well, if we
do something on behalf of the person.
if we continue to allow the agencies to define a couple of these categories as best suits their program, then they're all going to be using them differently. So putting it at the top would just, then you have to decipher the puzzle.
Okay,
So
okay.
this document is really like, we could expand on it. It just means copying and pasting from the contract or from the applications. And this is really meant to give you sort of like, how did they do compared to what they wanted to do? You know, but it is also not perfect in a different way that I shared with you that we're still learning about. And that is a lot of the organizations were not able to staff to the level they wanted to. So they didn't spend this much money and will be returning money. So this level of service didn't actually cost those amounts of money. We just don't have final numbers yet.
Yeah.
It's
Well,
really not a very perfect report in that way either.
yeah. Okay. Well, I'm just looking for clarification. Any other comments from anybody else?
This is Patty. Can you hear me?
Yes.
Okay, so I just was able to get audio. I just to kind of recap what Lynn and Annette was saying is in the application, there's a whole section on utilization, and we define non-treatment plan clients, treatment plan clients, screening contacts, CS, the community service events, and that is in every application for every program. So it does vary a little bit. And that's, you know, if it was more standardized and we were all doing the same thing, that's certainly an option, but what's meaningful to each program, I think, is beneficial. So if we might project that there would be 10 new people that would be interested in services, or 25 people that reached out to DSC and wanted to learn more about a specific service or a specific program, then we would count those as our screening contacts. Versus the on behalf of or with that Community Choices describes. We have all that data, we track it, but just what we've defined in the application under that utilization is a little bit different for most programs. So I don't know if
Yeah,
that helps.
well, that I absolutely don't want to have the board tell the programs what to do with your accounting. I'm just looking for clarity. When I see the numbers being so different for the same initials, I just want to know, okay, what are you counting? And now I understand, I think. Georgiana, do you have any?
No, I hadn't looked at that before you brought it up, but that is a good point that we're not comparing apples with, we are comparing apples with oranges, and it maybe not a good comparison. I don't know how to deal with that.
Well,
Yeah.
so along the same lines, there at the top of that document is probably the more important. There's a reference to the combined performance outcome reports of all these agencies. That's arguably more important. That's where they really tell you everything they were measuring and how it went. Sometimes that document is 400 pages long, so we don't put it in the board packet.
Thank you.
But we do link to it so that you have the information and so that the public has the information. So Kim, can you share a screen to that document? I mean, I know we haven't posted it yet because there are some formatting issues, but it's really like, I think more what you're interested in. It's just, we don't have room in the board packet. So this is the reference to like, to the year-end reports about the really cool, important stuff. But they're long because they
Yeah.
have all the detail that you're looking for that, you know, individualizes for each program and also explains what happened in each. So maybe in next year, we should not do this utilization summary report because it is really a very small subset of those, but just give you the full performance outcome report that's aggregated, even though it's a lot of pages. It's really,
Well, no, I think the summary is very good. And I think, Lynn, the point that I took from what you said earlier is you're looking at what their targets were compared to what they actually accomplished to kind of see, you know, how they're doing, you know, based on their own projections.
Well, they do-
And that's an interesting information.
well, they cover that in this too, and they also,
Yeah.
they make observations about what happened, and this is really where our best guidance for what to do next could be
Yeah.
coming from, you know, to connect the outcomes with what we do next and what they do next. So,
Well, I got the information I needed from both Community Choices and DSC. Thank you very much for clarifying that. I thought we were comparing apples and oranges, and we were. That's fine. Any other comments or questions about the utilization summaries? Okay.
This is Brenda.
Yeah,
This-
okay.
This is Brenda. I just like to say I really appreciate this conversation because I came in and didn't understand it, and I'm glad to have some clarification on it just for our organization, because I know Lynn helped me through some of the confusion when I first started. So I appreciate this conversation. It makes me feel a lot better. I don't feel quite so inadequate.
Brenda, I love talking to you. I think this is something that, you know, in our board meetings, we're focused on our staff are communicating to this board, and then this board has an opportunity to talk and make decisions. But the other thing is ideally we're communicating with the public too, which is why I love the comments about what's not clear and what could be better. That, you know, because we do want people to be able to understand this without having attended meetings for 20 years, you know?
Well, yeah, and it has been a crash course for me. And like I said, I really appreciate this conversation because I feel a lot better.
Well, good.
Good.
Thank
We
you.
want you to feel better. All right, thank you for that comment. Any other comments about item 11, old business? Then I think we're getting close to ready to wrap up. We've got the schedules. The November 16 meeting is going to be a significant meeting. We've got a meeting next week that's a study session. We should be reminded about that. That's at 5:45, which is on the Mental Health Board schedule. And we can do that by Zoom, right, Lynn?
And the topic is toward a comprehensive shelter system and housing system. So,
Excellent topic.
yeah.
Excellent topic. And November 16, we have a significant meeting of this group. And right now, we think we're going to be able to do Zoom, or we don't know yet.
Very likely. And I talked to the IT person about what if we do a hybrid meeting again so that people have the option. He will talk to me before November 16 to see if we can.
Okay.
Yeah.
Well, I think the Zoom option is working really, really well. Thank you to everybody that's been making that happen. And then the December meeting, I guess we'll decide after the November meeting whether we need to have a December meeting or not.
We do
Or
have
if we do, it'll be a brief meeting.
I need to have a public meeting for the opening of any RFP proposals on December 21, but that doesn't mean you have to have a board meeting or the mental health board. So we'll see what happens.
Okay.
You're right. It means getting all of our work done in November.
And Lynn, I've got a question. Has the RFP gone out? Is it public now?
Actually, we have a pre-proposal meeting that could have started at 10, but There are a few people here for that. So as soon as we're done, we'll start that. The RFP was posted immediately after your meeting with the changes that were discussed during the meeting. And that final version is at the link that I'm going to add to the minutes. We've had just a couple questions, but they were not substantially outside of what's in the RFP. They were just clarification of what's in the RFP. And then we'll have a discussion today. So it's out.
And do you have any interested parties? Yeah,
We'll find out at 10.
okay.
10:25.
10:25, you're right.
Yeah.
Or 10:15 or 10:16.
10:15. I've got 10:16 right now,
Okay.
so pretty soon.
So I wasn't sure what to expect because we asked people to notify us if they were coming to the pre-proposal conference, but I think there are some here. So we'll get to that pretty dang soon. Okay.
Okay. Next items are just information. Lynn, is there anything from the CCMHB that we need to know about, other than the fact that we have a study session next week?
Yeah, and they're meeting tonight.
Okay.
Similar track, yeah. Yep.
Staff reports, again, very much appreciated. Obviously, staff are busy. I don't know how you have time to put all your reports together because you're doing so much.
That is true.
And are there any board announcements? Disability Expo on Saturday. All right, this meeting is adjourned. Those who want to stay on to talk with Lynn about the RFP proposal, please do so. It will be immediately following this meeting. And Lynn, you said you did not need my participation in that, so I will sign off. Thank you.
Bye-bye.
Bye, everybody.
Okay, so if you are here for the pre-proposal conference, if you wouldn't mind signing in the chat so that we have an accurate record of who attended. And if you're not here for the pre-proposal conference, just unmute yourself and say hi. Okay, Lori Butler is here for the pre-proposal conference. There were a couple of other folks here. I don't know. I don't know what happened. Okay. So we have Kathleen Murphy from American Institutes for Research and Lori Butler from U of I. Jamie Olson is still here, but I don't know. Jamie, are you going to participate or did you just open the meeting? And then Yirang Park, I imagine. I think that is also a person here for the pre-proposal conference. So let's just introduce ourselves. Okay, I'm Lynn Kamstad. I'm the Executive Director of the Mental Health Board and DD Board. So Kim, you go next.
I'm Kim Baldry, the Associate Director for Intellectual and Developmental Disabilities for the Developmental Disabilities Board and Mental Health Board.
Got to tag somebody.
I'm Chandra Somerville, and I'm the Cultural and Linguistic Competence Coordinator for the Champaign County Mental Health Board and the Developmental Disabilities Boards.
Nice to meet you, Chandra. I'm Lori Butler with the University of Illinois, the Department of Psychology. I'm sitting in for a group who might have interest for the RFP. Thank you.
Great.
Leon Bryson, Associate Director for Mental Health and Substance Use Disorders. Nice to meet everyone.
I'll jump in. I'm Kathleen Murphy from the American Institutes for Research, and I direct their Individuals with Disabilities practice area. So similarly to Lori, I'm gathering information for others that might benefit from it.
Hi, I'm Yerang, and I'm also from the University of Illinois, and I work with Family Resiliency Center, and as a team at the center, I think we were also interested in learning more about the proposal. Nice to meet you all.
Sorry, someone was at the door and I thought maybe it was someone who came here in person to join us. Chris, did you get a chance to introduce yourself?
Nope, I am Chris Wilson. I am the financial manager for CCMHB CCDDB.
Okay, so what questions do you all have for us? I'll go ahead and put the RFP on the screen. Has everybody seen the RFP? Okay. I've had a few questions about it already. I'll tell you what they were, but it's on the screen there. One person asked if there was any specific licensing requirement because this is mental health. And I think what we asked for was for the applicant to describe their qualifications. We weren't being specific. This is not providing mental health services. So licensing is not required, but a demonstration of how they might be qualified to work on this project toward these goals is all that, I mean, that's what we're really asking for. Another asked if there were caps on indirect cost, and there are not. The two boards have a set of funding guidelines that each have a set of funding guidelines that are similar in almost every way, including that the indirect cost limit is really, negotiable. Like it has been 20%, but given the pressures on especially nonprofit organizations to have adequate infrastructure to survive contemporary billing systems, those indirect cost limits are a little bit unrealistic, but this would be, we have not set indirect cost limits within this because we're asking for a proposal about the realistic costs. And it might be for a project like this that it's difficult to say what's direct and indirect as well. And then the other question I had, that was that. Yeah, I think that was all of it. Oh, the other one was whether a researcher needed to be licensed within the state of Illinois. The proposal is silent on that. I have not heard any reason why we shouldn't. If a group is doing business outside of Illinois, it's probably all right. It's, we have no standard about that in this proposal. So do you have any questions?
I have one on the clarification of the specific evaluation that you're wanting. If it's, so I have a group who might be interested, but they have a very specific program. And my concern is should they apply to this RFP or should they wait for the next general one that you're getting ready to post? Because they have a very specific program for mental health. But this one, could you describe what you're wanting them to build? What's the evaluation, what you consider that?
This is to support agencies who are providing services in their own, in developing outcomes that make sense with what they can accomplish. What we've learned, I don't know if your group has an opportunity to look at what has happened. It started, there are links to all 7 annual reports on the work down here. So you can see what happened. Like this group of researchers would work with just 4 or 5 agencies at a time each year to develop a a theory of change logic model, and then some specific outcomes that made sense with their program. And that they could measure. That's where we started. They also did consultation with any agencies that were funded by us. They would do brief consultation, and they developed a resource bank, which had some measures that, evaluation tools that an organization might want to use. So that's where specific evaluation tools would end up in that bank of resources. So they actually found over the years the pressures on nonprofit agencies and the difficulties with staffing capacity. This is not just shortages, but also like the effect of really high turnover. In this last year, they ended up doing trainings on how to use Excel spreadsheets to manage your data. So, they were shifting with what the agency's abilities were, because the purpose was to build capacity. And as we saw capacity being eroded, they were, they're going further and further back in it. But still, the key issue is we need to see outcomes as a result of these investments of public tax dollars. But we don't want the measurement and reporting of those outcomes to undermine the services themselves or the nonprofit capacity to serve people. So it's, really within that context, what are the kind of supports that will help agencies now? So a proposal would address what the agencies need and how to help them get there,
Thank you. That helps, because that's what I had thought. It was an overall agency for your smaller nonprofit agencies that they would be working with as evaluation services, and not as a specific.
Even the large agencies are struggling. Yeah, everybody. Yeah.
Right, but different agencies, and not a researcher or a person who has a project that they wish to share with the community, right?
I think that's right. Okay. I mean, it could, this is open enough that they could try applying for something like that. And if it met these goals, if it could be connected to these goals, or if it were in combination with another application, we're meeting those goals, that might work. But it does sound like they have a specific idea.
Okay.
Services, right?
Well, I don't know yet. I'm gonna share what I've learned, but my gut was saying that they should wait for the next RFP that we would apply for in February, correct? Maybe?
Well, it's not an RFP. It's a sort of a field initiated request for proposals. And at the board meeting tonight, there's a draft of the mental health board suggested priorities and selection criteria for funding. And I wouldn't wait till February, because the deadline is February 10. So the system opens January 2nd for application. But to look at those priorities might be helpful. And that is in the board packet. Let's see, I might be able to get there to show y'all. Is this of interest to other people too? The board packet for tonight's meeting. So, hey, to my team members who are still here, do you want to comment at all on this work? And do you have I missed anything?
I mean, I can just speak a little bit to what I've seen in terms of the evaluation team. They were doing a great job with just some of the training and the mentoring and the coaching going on with the agencies that were participating in it, from just the hands-on, the virtual training, as Lynn pointed out, assisting them with learning Excel and just being an information and resource for some of our agencies. I think a lot of agencies took away some great things from that, just internally, just, you know, in terms of their structure, their infrastructure. That was just some of the stuff that I noticed. The peer exchange maybe was part of it. You know, just understanding how to better improve their systems. I don't know if others want to speak to it or not, but it's kind of what I got from it.
Thank you, Leon. I'm putting some links into the chat. The first one is the link to the board meeting tonight, and the second one is a link to just a list of all the services that are currently funded by both boards. And I also see that I'm getting low on battery. So there's that could happen. So anyway. Do y'all have any other questions or comments?
No, I think that this has been very helpful. Thank you. And thank you for the comments, Leon.
You're welcome.
Ms. Murphy, do you have any comments or questions, or are you good?
I'm good. Thank you for welcoming them.
And you're on? Are you working with Lori Butler or on behalf of a different group?
I work with Dr. Jacinda Dariotis.
Okay.
Yeah, and so I'm kind of here on behalf of her. And yeah, I think I've already gotten some useful information today, so I will relay this to her.
Okay. I'm so glad that you all came. I really wasn't expecting anyone. Yay. It's hard to have a party and no one shows up. Okay. Do anybody else? Any other comments or questions?
I will say that I worked with Dr. Nicole Allen and we sure enjoyed the past. So that was why I was anxious to just come join the board meeting and listen. So thank you.
Well, great. Thank you. Okay. Well, I'm going to let y'all go then and try to get this recording posted before I completely run out of battery. All right. Thank you.
Thank you.